I, Dr. Gauri,
And I, Dr. Shruti,
we welcome you all to Professor N.S. Sundaram and Mrs. Kamala Sundaram 4th Public Endowment Awards Ceremony. I would now invite on the dais Dr. Rishi Singh. Dr. Rishi Singh?
Dr. Shomi Bhattacharya,
Dr. Sudha Iyengar,
and Professor Dr. S. Natarajan.
I repeat again, Dr. Rishi Singh, so welcome. Dr. Shomi Bhattacharya,
Dr. Sudha Iyengar,
she's there. Welcome, ma'am.
welcome ma'am.
Welcome, sir. Dr. Natarajan. Welcome, sir.
Welcome, sir.
We would like to welcome you all with flowers. Dr. Rishi Singh first.
Dr. Shomi Bhattacharya, Dr. Sudha Iyengar, and Professor Dr. S. Natarajan.
I would now request Dr. Simran Singh to please come up to the dais. We would have the lighting of the lamp. Dr. Rishi Singh, Dr. Sudha Iyengar, Dr. Shomi Bhattacharya, and Dr. Natarajan. And
Thank you, everyone. I would request all of you to take your places. I'd now request Dr. Hemlata ma'am, Medical Director and HOD Pediatric Ophthalmology, to give a brief introduction on Aditya Jyot Eye Hospital. Welcome, ma'am.
Projector, please. Excuse me. Projector. Projector. Good evening, everyone. Can we have the projector on, please? I welcome all of you on behalf of Aditya Jyot Eye Hospital. Projector. Can we have the projector on, please?
Just see once if you can see through, then if it's blocking, then just request it to put out.
Okay. Can we project it to the side? Good evening, everyone. On behalf of Aditya Jyot Eye Hospital, I welcome all of you. A brief introduction to our hospital. Aditya Jyot Eye Hospital started in 1990 in Dadar and it moved to its present location in 2004 at Vadala. It was rated the best eye hospital in Mumbai by Outlook and the most trusted eye hospital by a survey in Reader's Digest magazine in 2016. And the hospital was established by our Chairman and Managing Director, Professor S. Natarajan, in 1990 in Dadar, and it has shifted to its current location at Varala. It's the only NABH accredited eye hospital. It has been visited by various celebrities and dignitaries like former President of India, APJ Abdul Kalam, and the former Governor of Maharashtra, Shri S.M. Krishna, and the Chief Minister of Maharashtra, Shri Vilasrao Deshmukh. The vision of our hospital: Aditya Jyot Eye Hospital strives to provide world-class eye care service under one roof by innovative service through research. And the mission of our hospital is: it will remain attentive to the eye care and well-being of those whom we serve through patient-focused care with 100% satisfaction and 0% error. We are also into patient education and services, so that's the main mission of our hospital. We believe that a patient is the most important visitor on our premises. He is not dependent on us, but we are dependent on him. He is not an interruption to our work. He is the purpose of our work. He is a part of it, and we are not doing him any favor by serving him. In fact, all the patients are doing us a favor by giving us an opportunity to do so. The policy of the hospital is to excel in the field of ophthalmology and ocular surgery and provide international quality treatment. It provides services of the highest possible standards to satisfy our patients' needs, expectations of quality, safety, reliability, and service. We also aim to offer the latest in the field of ophthalmology in diagnosis and treatment of eye diseases. Hence, we are into various research projects, and we accept patients of all socio-economic status and emergency patients in the ophthalmology 24/7 all throughout the 365 days. Now, to make all efforts to achieve 100% patient satisfaction, we also do continuous improvements in our own services. We conduct various education programs for patients and their relatives, and it's also our policy to maintain an ambient and clean atmosphere in the center to make the patients and relatives comfortable. And we have 3 operation theatres of international standards of safety and sterility. These are our wards. We have all the subspecialties in ophthalmology, namely the vitreoretina services. We offer cataract services, cornea, and we have orbit and oculoplasty. We have neuro-ophthalmology, glaucoma, pediatric ophthalmology. We have our squint clinic. Then we deal with LASIK and refractive surgery. We have specialized clinic for uveitis and oculoprosthesis. We have all the diagnostic equipment which is present, that is the latest in the country. We conduct various education programs, as in postgraduate education program like DNB and fellowship courses. We have fellowships post MS and DNB in various subspecialties, namely retina, cornea, pediatric ophthalmology, and also for phaco and FICS training. We have trained more than thousands of eye doctors from India and abroad at our institute. So this is our current team of doctors headed by Professor Dr. S. Natarajan. We are into a lot of innovation and research. We are in the first in Asia to have a retinal endoscope and the preferential hyperacuity meter. We are in the first in India to have a constellation vitrectomy system. We have the Fourier domain optical coherence tomography for retina, cornea, and glaucoma. We were the first ones. Now it's 27 gauge vitrectomy in our hospital. Then we have a biome based wet lab, and we are also into training of postgraduate students and fellows. So these students extensively practice in the wet lab. We were first in the Mumbai to have the IOL master, and we have equipment for detecting the abnormalities of nerve conduction like multifocal ERG and multifocal BEP. As I just discussed, we are into various postgraduate education programs, and last year our students from the Optometry Institute represented our hospital in the World Optometry Day, and they won many prizes. Honorable Dr. S.S. Badrinath inaugurated the Aditya Jyot Eye Hospital in 1990, and then the LASIK Pavilion Center was also inaugurated by him on 26 October 2001. The institute grew in time and added many more divisions of eye care under one roof, and in 2004 our hospital moved to Vadala. We have all the 15 subdivisions about which I mentioned briefly. So these are the various people who have visited our hospital. Shri Sushil Kumar Shinde and Mrs. Aishwarya Rai inaugurated our present hospital in 2004, and Dr. APJ Abdul Kalam visited us, and we have various celebrities visiting our hospital. Thank you.
Thank you, Dr. Hemlata, for that wonderful introduction. I would now request Dr. Radhika, CEO of Aditya Jyot Foundation for Twinkling Little Eyes, to give us the background to today's oration. Welcome, Radhika.
Good evening, ladies and gentlemen. I would like to give you a brief introduction to the reason for setting up this endowment lecture. The man behind this endowment oration, Professor Dr. N.S. Sundaram, the late Dr. N.S. Sundaram, the father of Professor Dr. S. Natarajan. Dr. Sundaram hails from a family of ophthalmologists. His father before him, Dr. S. Nataraja Pillai, was an ophthalmologist, and of course Dr. Natarajan, his son, also is a third generation ophthalmologist. Those of you who had the opportunity to know Dr. Sundaram would know the kind of driving force or the power that he was, and I think Dr. Natarajan has inherited a lot of that from him. He was born in 1927 and passed away last year on 17th April. He was born in Kulasekarapatnam in Tamil Nadu, and he retired as the superintendent of the Government Ophthalmic Hospital, Egmore. He was the professor of ophthalmology of the Madras Medical College. He is credited with a number of activities or initiatives that he has undertaken when he was serving as the superintendent at the Government Ophthalmic Hospital. In fact, he had the foresight to initiate or set up a genetic clinic in those days. Dr. Kumara Manikavel, who is now the director of research at our institute, was motivated by him to take genetics up. Though in those days it was a non-existent or rather a very unknown specialty in India. So he started specialty clinics for cornea, retina, genetics, uvea, orbit, and as I said, the first special clinic of genetics was also initiated by him. And to his credit, he has performed over 30,000 cataract surgeries for the poor, the marginalized. Nearly with a group under him, he has completed more than 1 million surgeries, and he always believed in refracting his patients himself, so he has done more than 3 million refractions. He was very passionate about the eye camps because he felt that the medicine should not be restricted to a clinic, and he felt that it should be taken out to the people who are in need of it and who may not be visiting the eye clinics because of either lack of time or the lack of money. And he has conducted more than 100 eye camps, and separately under the banner of various NGOs like Lions, the Sai Trust, the Kanchi Trust, etc. And he believed no eye of any age is exempt from disease or injury except when it is guarded, protected and preserved. These are some snapshots of various exhibitions that he set up. Many of them were in Chennai, some of them here in Mumbai, and he motivated the optometry students to make models, eye models, various disease models, etc., which he would ask them to then present it at various exhibitions. And even today in Chennai, there is a dedicated eye center named after him in the Science Center. These are again some snapshots of various exhibitions that he's conducted. He also was an avid reader and a writer. He has written both in Tamil as well as in English, because he felt that Indians per se don't read much, don't take the initiative of trying to gain knowledge. So he felt that it was necessary that education should be taken to them and they should be reading about various eye diseases so that it would help prevent many diseases. He is the recipient of the Seva Ratna by the Centenarian Trust, the Vaidya Ratna by Sri Kanchi Kamakoti Jayendra Swamigal, the Lifetime Achievement Award by the Tamil Nadu Ophthalmic Association, and the Dr. G. Venkatsamy Award for Community Ophthalmology. Vision is our mission was his motto. And he, for the couple of years before his death, he served as the rector of the Aditya Jyot Institute of Optometry, and he was a mentor of the Aditya Jyot Foundation for Twinkling Little Eyes. And I still remember the day when he used to passionately tell me that we should work not with any motive of making money, but just so that the mission of eye care for the poor is served. This was it was at his initiative that the first eye care center of our NGO, the Aditya Jyot Foundation, was set up in Dharavi. He took up a small place on rent, and in fact, he used to sit there himself, saying that I will see the patients here if nobody else is available. And so this is how, because of his passion for teaching, his passion for spreading knowledge and awareness, that Dr. Natarajan decided that an endowment award in his name and his late mother's name, Srimati Kamala Sundaram. This endowment award recognizes individuals who have made exemplary contributions in any field of science or education that helps alleviate the suffering of humankind. The previous recipients of the Professor Dr. N.S. Sundaram and Mrs. Kamala Sundaram Endowment Award, Dr. Gyan John Prakash was the first recipient. He is the director of the International Program Activities at the National Eye Institute, National Institutes of Health. The second recipient was Dr. Neil Bressler, the Chief of Retina, John Hopkins University School of Medicine. And the third recipient was Dr. Marco Mura, the Director, Retina Center at the Netherlands. And today we are very proud and happy. The fourth Dr. N.S. Sundaram and Mrs. Kamala Sundaram Endowment Award is being awarded to Dr. Rishi Singh, the President of the Retina World Congress, a vitreoretina surgeon of the Cole Eye Institute, Cleveland Clinic, and an Associate Professor of Ophthalmology, Lerner College of Medicine. Thank you.
Thank you so much, Dr. Radhika, for throwing light on the life, ideology and achievements of Professor Dr. N.S. Sundaram. I'd now request Professor Dr. S. Natarajan to give a brief introduction to Dr. Rishi Singh, who is our chief guest tonight, and also read out the scroll of honor. Welcome, sir.
Thank you, Rishi, for coming here all the way. And Rishi had a 24-hour flight delay, so he was in 48 hours. You can see his wife and son trying to be awake with the time difference. Thank you, Rishi, and what's your son's name? Sachin. Sachin, thank you very much for being awake. Your dad is giving the oration. And these are my parents. So in India and rather everywhere, we salute Mata, Pita, Guru, and Mitra and Deva. My Mitra is missing here, that's Shivanandan. He says too much of science for him today. I have the honor to read the citation which we are going to give. It reads as Aditya Jyot Eye Hospital presents the scroll of honor on the occasion of the 4th Professor Dr. N.S. Sundaram and Mrs. Kamala Sundaram Endowment Award on Tuesday, 20th December to Rishi Singh. And for his profound dedication towards the progress in the field of ophthalmology and visual sciences. Dr. Rishi Singh is a staff surgeon at the Cole Eye Institute, Cleveland Clinic, and an associate professor of ophthalmology at the Lerner College of Medicine in Cleveland, Ohio. He also currently serves as the President, Retina World Congress, and Medical Director of Informatics at the Cleveland Clinic. He received his medical degree from Boston University in the prestigious Accelerated Medical Program and completed his residency at the Mass Eye Infirmary, Harvard Combined Program in Boston, Massachusetts. And Dr. Singh then completed a medical and surgical fellowship at the Cole Eye Institute in Cleveland, Ohio. He specializes in the treatment of medical and surgical retinal disease such as diabetic retinopathy and age-related macular degeneration. He has authored more than 70 peer-reviewed publications, books, book chapters, and serves as the principal investigator of numerous national clinical trials advancing the treatment of retinal disease. He is a frequently invited speaker at national and international meetings as well as continuing medical education seminars. He is also a reviewer for various ophthalmology and diabetes medical publications including Archives of Ophthalmology, American Journal of Ophthalmology, IOVS, and Ophthalmology. He maintains a strong relationship with drug development and commercial entities by serving on scientific advisory board. And Dr. Rishi Singh's current work focuses on the electronic medical records, implementation, lean process improvement, and decision support modules for clinical practice. He operates the Cleveland Clinic Electronic Health Record Consulting Program. He has been honored with several research recognitions such as the Alpha Omega Alpha Research Award and the American Society of Retina Specialists Senior Honor Award. And I have this great honor to invite Professor Rishi Singh to the stage.
Congratulations, sir. Beginning now with the award ceremony, I would now request Mrs. Rajalakshmi Rao, Chairperson National Eye Care Relief, to please come up to the dais and confer the plaque. Mrs. Rajalakshmi Rao, welcome, ma'am. The plaque.
I would now call Dr. Chinmay Nakma to award the medal.
Thank you so much, ma'am. Welcome, sir. I would now invite Dr. Sudha Iyengar to please come to the dais and give away the shawl. Welcome, ma'am.
Very easy. Americans are the Indian origin.
Thank you.
Thank you, Dr. Sudha. I now invite Dr. Hemlata Vidyashankar to give the gift.
And before his wife and son. Can you both come? What's her name?
Dr. Simran Singh.
And your son. Please come, Sachin.
Welcome on the stage, both of you.
Patient-focused lecture on AMD therapies and what we've learned. We've had such an advance in our treatments of these diseases of the eye, and one of the reasons why I went into eye care and eye treatment and eye therapies is that there was a lot to be done. You know, when I first started in this field, the only therapies we had were steroids. We gave steroids for everything. You had a red eye, we gave a steroid. You had macular degeneration, we gave a steroid. You had diabetes, we gave steroids. And in the past few years, there have been huge advancements in therapies because of people like Natarajan and like myself and other people in the field who really advanced the treatment of macular degeneration and other diseases. And I'm going to tell you about some of those treatments and some of those diseases today. So let's start with the lecture. And I first want to thank again Natarajan and the endowed lecturer that his family and he has started for this. We share many things in common. The three things that I thought of today were, the first is that we have a huge commitment to research. We both agree that this field has to progress, and we've done a lot, and we've continued to do a lot. He's very humble, but he's the editor of one of our major journals in ophthalmology and has done a lot in our field to advance therapies. And when I visited his clinic today, I was so impressed by how much he's doing and how much he's going forward with in research, in clinical research and basic science research. The second is trainees and training. He's had the pleasure of training 80 fellows in his years, and I've only trained 10 years worth of fellows, which is much smaller in number, but it's great to teach new oncoming faculty and make them contribute to the field as we all have. And the last is our love of iPhones and being connected. I've never seen an ophthalmologist be on WhatsApp or Facebook more than Natarajan and do all the things he's doing on top of that. He's truly an amazing person, and I thank him again for his hospitality and everyone from his groups here, hospitality, and having us come to this program today. So for this lecture tonight, I'm going to discuss really, how macular degeneration develops. You've probably heard of this condition as a patient. Maybe you're not aware of what the symptoms are. Maybe you might have it even tonight. And this lecture will help point out what that is. We're also going to discuss how age, smoking, and some of the other risk factors that are modifiable, things you can change in your own lifestyle today, may make a difference in what your outcome is. And lastly, I'm going to demonstrate how some of the things like vitamin supplementation have really advanced our ability to take care of patients in this condition. It's actually interesting because vitamin therapy has never been shown in almost any other disease state, cardiovascular, cancer, orthopedics, to really change how the outcome is. And in this case, vitamin therapy has really demonstrated an ability to reduce vision loss and to reduce the progression of age-related macular degeneration over time. So for those of you who don't know, macular degeneration is a disease that causes central sight issues in the area called the macula. And what it can start off like is in this video, you'll see the ability to have distortion or changes in your central vision to the point where you start to get graying and blockage of the central vision. And you can imagine how this would affect a patient's ability to do the day-to-day things. Seeing the food on your plate, figuring out if you had a $10 bill or a $50 bill in your hand, being able to write a check. These are all very, very difficult things for a patient with macular degeneration. And so symptoms like this is typically what the patient starts to complain of, is visual distortion, blurring, changes in their vision that are really subtle, gradual in onset, and therefore they need an evaluation by an ophthalmologist like all of us. And when we talk about the eye, we have to think about the complexity of it, because there's different parts to the eye. There's the cornea, which is the front of the eye, the iris, which is the colored part of the eye. And when you go into the back of the eye, the film of if you think of the eye like a camera, the film of the eye becomes the retina. And the retina has a central part, which is where the vision comes from. And that's where we have the most precise sight we have in our eyes is from the macula. The macula is the most important in the precise vision that we get in what we need to do in our normal tasks. And that's the location of it there. So we know that macular degeneration can develop, and that happens to be where you have either the growth of new blood vessels in the center of the vision, or you have atrophy and damage of it from aging and changes. And so they're called either the dry type or the wet type, depending on that. So there's two different flavors of macular degeneration. You can see on the top here, you can have blood from the wet type, or on the bottom here you can have drying or atrophy from the dry type of macular degeneration there. And for this condition, we know that there's lots of different treatments now. You may have heard of people getting eye injections now for the treatment of wet age-related macular degeneration, where we give anti-growth factor drugs to their eyeballs and inject them in the office, and that prevents the progression of disease. But for this condition, we have no treatment right now. And this is about 80% of our patients have that condition currently. So it's a huge area we have to work on, a lot of research being done, and I'm going to talk about how vitamins have really slowed that progression over time of those areas. When you think about macular degeneration, you have a couple different causes of it. The first is oxidative stress. Well, that's really aging of the eye. Oxidative stress happens because of aging the eye. You can have increased oxidative stress when you smoke. So that can also cause increased oxidative damage to the eye over time. There's a genetic predisposition, meaning that you can have people in your family, primary relatives, fathers, mothers, who have age-related macular degeneration, then you develop it over time. And as we all grow older and we all stay around longer because of good health, we are now reaching our point where we're more people in their 80s and 90s. A lot more people are developing this condition over time. And finally, environmental factors which have been identified, such as dietary habits, obesity, other sort of issues that are in our environment that we take into account, and sun exposure especially are one things that cause this sort of damage. And this all causes a correlation or a cascade of events that leads to damage to the central part of the vision from a lot of different biochemical reactions, and then you get advanced forms of macular degeneration. Now, there's lots of risk factors that you as patients can do to prevent this from happening. The first is smoking. Smoking, if you're a current smoker, you have a 4 times greater risk of macular degeneration versus if you had no smoking history at all. So just by stopping smoking, you can decrease that risk significantly. And in fact, in 5 years, if you stop smoking, your risk is just equal to if you didn't smoke at all. So even if you're a former smoker or a current smoker, you can really reduce that risk by stopping smoking altogether. Obesity. Well, we found that those patients who have advanced forms of macular degeneration also are obese patients because they have greater oxidative stress potentially, and obesity goes hand in hand with the progression of these conditions, and many studies have been done. Family history I mentioned to you before. Having a primary relative like a father or mother with this condition can also lead to a higher predilection of you having this as well. Somewhere between 1.5 and 1.7 times higher risk if you have a family relative with this condition. Gender, women are appear to be greater risk than men. And finally, the big one here is nutritional deficiencies. And I think that that's what we're figuring out more and more in the adult population. As we get older, our biochemistry changes. And so we think that we don't need to have necessarily as much food or much vitamins. And you see that change as far as nutritional habits go in older American individuals and older individuals in general. And I'll show you some studies that show some results of that. So let's first talk about age. The age is one of the risk factors, unfortunately, you can't change. And the higher your age goes, the greater your predilection to having macular degeneration. In fact, 1/3 of the patients above the age of 75 have some form of macular degeneration, and 1/2 of patients, 50%, over the age of 85 have macular degeneration as well. So very, very high numbers of patients over the age of 85 for that condition. And one of the things we're realizing is vitamin therapy can actually prevent vision loss in these patients. And let me show you some studies or some data around that. Well, we know that just taking vitamin C, E, and beta-carotene can really reduce the progression of these diseases because in animal models it's been shown to prevent damage to the retina. If you have low levels of those vitamins, you have very high damage to the retina. By taking vitamin supplements, you can reverse that. And vitamin C actually is important for the cells of the eye, the photoreceptors, in order for them to function and to turn over so they don't get injured over time from seeing light or having flashes of light applied. Here's just some examples of where you get vitamin C, E, and beta-carotene from. Many of the common fruits and vegetables you have, such as carrots, kale, spinach, cantaloupes, a lot of the citrus fruits have vitamin C. Vitamin E is mainly present in cucumbers and corn and vegetables, green leafy vegetables, colorful things. I tell my son all the time, when he has dinner, I say, have something more colorful than brown on the plate, because all those things, vitamin C, E, and beta-carotene, really come out when you take those sort of foods. Zinc is also very important. One of the nutrients that we see a lot in deficient adult people is the lack of zinc in their diets and lack of zinc in their bodies. And in fact, if you have low levels of zinc, you have high defects in the retina, and you can develop drusen and changes in the retina, which causes accumulation and damage to the retina over time. And zinc deficiency is actually very common in the elderly. In fact, if you look at a population, they've done nursing home studies of zinc patients and found about 20 to 30% of patients within nursing homes actually have zinc deficiency. And this is a problem because zinc is not necessarily something we always eat, because it's mainly in red meats and it's mainly in fish. So if you have diets that don't have fish or red meat in them, it's very hard to get high levels of zinc in your diet without vitamin supplementation. Now, the other thing I'll tell you about is lutein and zeaxanthine, and this is a very important pigment. And actually, this is the pigment in the macula, and you can see the yellow pigment here. This yellow pigment actually is from a monkey, and it shows you the lutein and zeaxanthine in that monkey's retina. And that's the same pigment that's in our retina as well. So having supplements to increase that level of lutein and zeaxanthine can prevent damage to the retina from just phototoxicity over time. Here's just an example of what happens when you take those lutein and zeaxanthine supplements. You can actually increase levels orally by taking those lutein and zeaxanthine supplements within the retina. So just because you take these vitamins orally, you have to make sure it gets to the right place. And what we found, at least for lutein and zeaxanthine, is there's good evidence to show that supplementation can really increase the density of that pigment within the retina by applying that there. Now, one of the things we realized about aging is that it can change the nutritional habits. In fact, as an older American, they consume less calories than they do when they're middle-aged people. And we know that the association with this is because also that there's differences in the gastrointestinal tract of older Americans, older adults as well. And those older adults can then therefore not have as much vitamin absorption through that gut as part of that aging process. So they need nutritional supplements in order to reduce or to decrease those deficiencies. Just to show you how common malnutrition is in older adults, 5 to 10% are considered clinically malnourished, and about 35% in long-term facilities, nursing homes and otherwise, are considered under the clinical definition of malnutrition. And finally, 60% of patients in hospitals are considered malnourished. So you can see this is a population at risk here for developing these sort of conditions over time. And in fact, if you look at a couple different studies, this is a large study of about 6,000 older adult patients over the age of 50. 90% of those did meet the recommended daily allowance for vitamins in their diet, and 50% don't meet their recommended daily allowances for zinc and vitamin C. So having very low levels of these nutrients in the body is probably one of the reasons why we develop conditions like dry and wet age-related macular degeneration over time. Now, we know that also with zinc, I mentioned to you before, there's a low level of zinc in people, in older adults as well, and 30% of patients actually are considered zinc deficient, and it's easily replaceable with zinc supplementation. So we have this whole lot of risk factors here that we talked about with regards to both oxidative stress, genetics, and obviously the issue with malnutrition. And so what is the biggest risk factor here in this case? And in fact, if you look at this, macular degeneration has a very, very high rate of genetic components that cause it in comparison to other diseases. And these are some of the other diseases you see out there: obesity, cardiovascular, prostate cancer, breast cancer, type 2 diabetes. This is their genetic load or genetic correlation in comparison to age-related macular degeneration, so it's much, much higher. So you might just say, if the genetic point is there, if my father has it or if my mother has it, what can I do as a patient? Because I'm certainly going to get it. And the answer is actually, we've seen with multiple studies, if you take supplements like beta-carotene and zinc, and you take increased supplements, you can actually decrease that genetic risk over time by taking high levels of those vitamins in your diet. And this was a study that was done a while ago that really demonstrates with patients with a certain type of genetic disorder or mutation where they have a high risk of developing age-related macular degeneration, they can reduce that risk by having high levels of their vitamins in their diet. And this is another genetic component. Again, ARMS2 is a very high associated genetic condition with the progression to both wet and dry age-related macular degeneration. And you see again with high levels of zinc and with high levels of other lipid agents and nutritional agents, you can reduce that risk over time. So I might be speaking today from a level of information that just is from what we think is an association. But the reality is that we've actually done very, very good studies in this field, and there's two studies in particular I'm going to talk about tonight. The first is the AREDS-1 and the AREDS-2 study. And these studies were a landmark because they showed that vitamin therapy in these patients is actually beneficial. So up until now, I've shown you all of this data that just shows that it's an association. But now these studies have now shown with vitamin supplementation, especially with AREDS-1 and 2, that they actually do make a difference. Let me show you what that means. The AREDS formulation is made up of these vitamins. It's zinc, vitamin C, E, beta-carotene, and cupric oxide, copper. And this is given to you as a supplement. It's a single pill. It's given twice a day. And it's been around for almost 20 years now. And the study that it was done on has really shown the benefit of this progression or slowing of the progression over time. Now, one important thing to remember is beta-carotene is not for everyone who's taking, shouldn't be for everyone who's taking the vitamins right now, because if you're a current or former smoker, it can increase your risk of lung cancer. So you should not take just beta-carotene supplements if you're a current or former smoker. However, if you look at the data from the study, it's quite compelling. On the top graph here, you see patients who had a placebo. On the bottom, you see those patients who developed macular degeneration who were on the actual oral agent, antioxidants and zinc. So you reduce the rate by almost 30% in those patients who took the vitamin supplement developing macular degeneration over time. And in fact, you reduce the rates of vision loss by taking these supplements, the antioxidants plus the zinc, by 3 lines of vision loss, so 3 lines on the eye chart, losing 3 lines of vision on the eye chart, by 6 lines of vision on the eye chart, by preventing legal blindness 2100 or worse. You had a much lower rate of patients who are 2100 or worse or legally blind who took these vitamin supplements versus those who had the placebo. And this was, again, the first inclination of any study that's been done in medicine that vitamin supplementation actually makes a difference with regards to function and outcomes in this population. So now we have the vitamin formulation I showed you here, and this was then studied in more recent times in the AREDS-2 study. And what they did in the AREDS-2 study is they added lutein and zeaxanthine back because those weren't available initially when they first did the formulation, so they added it back to see if that made a difference. And the second thing is they've been talking about omega-3s and whether omega-3s from fish, especially oily fish, make a difference as far as outcomes go with regards to nutrition and outcomes in macular degeneration. And this study was just completed and shows basically no difference between adding in the omega-3 and adding in the lutein and zeaxanthine with regards to the supplement. So it didn't show a significant benefit for either of these two supplements with the exception of one thing. If your diets were very low in fish intake in general, you benefited a lot from the omega-3s in the actual vitamin. It's only patients who had a high level of omega-3s because they had a diet full of fish all the time. They did not need that omega-3 supplementation. So that's actually why the study actually showed that difference. And finally now, this is the new AREDS formulation. Now that they've added back the lutein and zeaxanthine, left out the omega-3. Only you need to take the omega-3 if you don't have fish in your diet from the omega-3. And now it's vitamin C, E, lutein, and zeaxanthine, zinc, and copper. Those are the major formulations for the AREDS diet now. So just to summarize and conclude, again, I think the idea, what we've found from macular degeneration studies has been that it's a multifactorial disease. There's lots of risk factors, like I mentioned to you before, such as smoking, aging, and also family history. And there's a large genetic component that actually can be changed with at least the addition or balanced with the addition of micronutrients in the diet. And AREDS 1 and 2 have been really critical studies of showing that micronutrient replenishment by giving these vitamins has shown a decrease in their progression over time. With that, I want to thank you again for your attention. Thank you for coming tonight.